Hi, this is Maureen O'Hara, one of the PAs on the ODA service, and I am going to continue on with this Tuesday bundle. And these are the forms that you'll need for Wednesday morning, so you can bring those with you when you come to the pre-op area, and then they can be filled out in the pre-op area and then put on the chart. So we have our post-op day 0 orders. This is an old form. On the new form, you need to put in some more lab values, put in your name, your pager number, put in the diagnosis, what any allergies the patient may have. The history of seizure is for tramadol because it's contraindicated. Patients have seizures to use tramadol, and I've actually given patients seizures that I did not realize were seizure prone. So I learned that the hard way. You be sure you want to check off discussion with the patient when you ask them about allergies. And then the rest of this is, it's kind of a busy form, but you just want to go through and check everything off. We want the fluids to be continued in the PAR. That's what this is about. You need to pick some PO and some injectable pain medication. So I think now they're using Norco. Remember to extend the time for people with renal problems, or you can go half the dose. You can go down to you can change this to 5 if you like. I think the Vicodin's being phased out. Then with the morphine, this is a dose for a 70-kilo man, and you can alternate this with the pain medication. Sometimes that's nice. They don't like you to write for breakthrough pain, so you just need to write for severe pain. And then you can date it and sign it and put your dictation number, but time it at the end of surgery when you walk out the door to go to the next case so that the nurses don't look like they've been delinquent in taking off the orders. Here's page 2. This is the Symes and Above pain management cocktail. We like to add gabapentin. For little old ladies, you can change this to 100 milligrams. Instead of using the morphine here on a routine basis, then we like to do this around the clock. And you need to calculate it for the weight based also with their creatinines, so you can reduce that. And we do this around the clock for 24 hours. We like to hit all their receptors, so we give them tramadol. I like to make that routine for 5 days, and then it's PRN. We want vital signs Q shift. We want to do this pulse oximetry and the oxygen for people that are on morphine around the clock. Everybody's bed rest with bathroom privileges. We want whatever extremity it is to be elevated. If they've got surgery on both sides, then you want to pick both. And then the dressings are now changed on post-op day 1 and 2. This is an older form. And for the BKs or skin grafts, then we do it on post-op day 5, which is Monday. And you put the date in here. We want to be called for pain medication problems. And you want to order this with morphine around the clock. It's just a tracer that runs overnight, and I have had a few people go into respiratory failure. So that's a safety measure for those people. If you use a wound vac, you want it to be intermittent suction, and you want it to be 5 minutes on and 1 minute off. And be sure to check that off at the end of surgery. Or if you use a drain, sometimes you use a Jackson Pratt or a Hemovac, so you want to check that off too. Be sure to date, time, and sign at the end of surgery. Remember, you can date, do your signature and your dictation number ahead of time, but do the time at the end. Then this is physical therapy. Occupational therapy is only for these people. Everybody gets a splint except for BKs. And for the people that have feet, you want to be sure to include the ODS insert. And you need to adjust the time if there's a holiday on Monday. So I'm going to stop here and I'll pick up with my next segment.